Hello and welcome back to the Biochemistry for Health Sciences channel. In today's video, we shall summarize chapters 1 to 8. In video 7.5, we summarized chapters 1 to 7, which dealt with cells and biomolecules, metabolism, regulation of metabolism, as well as cell signaling. Now, in videos 8.0 to 8.21, which is chapter 8, we discussed this important topic called cell division, adaptation, and cell death. The key question in this chapter is, how do cells divide, adapt to changing conditions, and how do cells die? And all of these, cell division, adaptation, and cell death, all of these are necessary for human survival. So in these chapter, in these videos, we discuss labile, stable, and non-dividing cells. We discuss how a cell divides. We discuss the synthesis of DNA, or what we call replication, as well as the synthesis and the catabolism of the building blocks of nucleic acids, the purine and the pyrimidine nucleotides. We also discuss how cells adapt to a changing environment, as well as cell death. So basically, how cells respond to stress. We then discuss this very important topic called oxidative stress. And finally, we discuss various programmed cell death pathways, including apoptosis, necroptosis, pyroptosis, parthenosis, ferroptosis, cryptoptosis, and oxyoptosis. So hopefully these examples give you a good idea of the various stresses that a cell can face and how it can program itself to die if it cannot stop the stress. So these chapters 1 to 8, these chapters really form the foundations of biochemistry. Again, that includes cells and biomolecules, metabolism, regulation of metabolism, cell signaling, and cell division, adaptation, and death. So with these chapters 1 to 8, with this foundation in biochemistry, now you should be able to use this information to connect biochemistry with the other medical science classes, and especially with physiology, where there's a lot of biochemistry concepts, as well as the study of disease, pathology, and in the use of drugs for treating these diseases, the field called pharmacology. Together with the foundations of biochemistry, chapters 1 to 8, as well as background in the other basic medical sciences, you should now be able to answer all kinds of medically related questions. Questions such as, should I use the drug Herceptin for my patient who has breast cancer? Why does the cancer cell continue to divide? Why does it not die by programmed cell death? How does this drug, trastuzumab emtansine, work? This is a very recently developed drug. It's an antibody drug conjugate designed for treating breast cancer. So to keep up with the latest in technology, biomedical technology, it's important to have a solid background in biochemistry. Why is chemotherapy causing hyperphosphatemia in my patient? Why is there so much phosphate, high concentration of phosphate in the patient undergoing chemotherapy? Do cancer cells use different metabolic strategies to generate their energy compared to normal cells? How does chronically high blood glucose levels cause the complications of diabetes? Should I use a rapid acting, a short acting, an intermediate acting, or a long acting insulin for my patient? What blood test would be appropriate for my diabetic patient? Why is my patient's glucose so low, hypoglycemia? Why is my patient's bilirubin elevated? And in case of all the different genetic diseases, questions like what we see in cystic fibrosis, for example, how is the protein CFTR related to cystic fibrosis? What does delta F508 mean in patients with cystic fibrosis? Why is the child with cystic fibrosis coughing so often? Why is this symptom so common in children with cystic fibrosis? What is this very important test for cystic fibrosis called the sweat test? So making these connections between molecules to disease will help you a lot in tackling all kinds of medical questions. So in future videos, we shall focus more on the clinical applications of biochemistry. So until the next video, once again, thank you very much for watching and supporting this channel. Have a wonderful day, and we'll hopefully see you in the next video.